So everyone will be muted. We've got pre-submitted questions that I'll ask. If you want to ask anything, pop them in the chat and I'll work my way through them and we'll hopefully get all the questions asked today. So we'll start with our first question.
Do you want me to put a little context in, Nate? Do you want me to just give you a little bit of context of what's happening? So, so as well as a consultant in public health, I'm also the regional lead for Hywel for Test, Trace and Protect, which is the program the Welsh Government brought in around coronavirus. So Mike is more the expert in the test element, which is actually the testing program. And I'm kind of very much the lead around the contact tracing. So I think I just wanted to kind of give a little bit of a flavor of what we do. So we have symptomatic individuals will go and get tested and they'll return a COVID positive test or a negative. If they're positive, they come into our contact tracing. And so what we do is we will call you, and some of your students will have had this. We will call you, we will ask about your symptoms, when they started. We will ask where you were for the 48 hours prior to them starting. And that's because we know you become infectious, i.e. you can give this virus to other people 48 hours before you actually show symptoms. So that's why we choose that window of time. And then we will ask you to isolate for 10 days, because that's how long we have an average of how long you are then still infectious once you show symptoms. So we will ask you to isolate for that amount of time. Anyone you've been in contact with in that 48 hours up until now, the point at which you are making the phone call, we will then be asking them to isolate for 14 days from their last contact. That is because that's how long it takes the virus at its maximum to create enough virus in you to give you symptoms and make you infectious. So there's a 14-day window that we're asking you to isolate, and that is very specific around this particular virus. Every single bug has a different period of time in terms of when you're infectious and how long it takes to make you ill. And so those are the two terms we use, as infectious period and incubation period, and that's how long it takes for you to make you unwell. So that's the basic process of what we're doing for contact tracing, is to try and stop that transmission happening. So the contacts you've already exposed, we want to make sure we've got hold of them, that if they do become ill, they're not passing it on to anyone else. So that's the whole reason between the contact tracing and the isolation, and why we're doing what we're doing, is we're trying to break that chain of transmission so we're not getting anyone else sick. So, and we within our team look at the epidemiology, which is the disease study of diseases, and we're looking at figures from a range of different places. So we get information from Public Health Wales on how many cases have been in an area. We then work that out to a population so we can compare area to area. We get that figure in, we look at the age groups of people who are being ill, we look at where you are geographically, so we can identify any patterns in that transmission. We then also gather all the information that when you've been speaking to the contact tracers, we get a little bit of that qualitative information. So we're looking at the sorts of places you've been to. So if it's a certain pub that people are going to, are we looking at that as a potential center for infection? And from that, we then build a better picture. And that's what underpins the decisions we make around some of the interventions, the control measures, we call them, to try and again, break that transmission. And that's the whole point of what we're trying to do in Test, Trace and Protect. So I just thought I'd give you that little bit of a picture so you understand that we're not doing anything in isolation. We work in partnership. We have what's called an incident management team established in Ceredigion that brings together Public Health Wales, the Health Board, the local authority, the university, the Students' Union, all meet regularly to talk about everything that's going on and make decisions about how do we try and keep people safe, protect them from getting this virus, and those that have it, how do we stop them, how do we keep an eye on them and make sure they're well and their well-being is good, and how do we stop those passing that on. So that's the whole point of what we're trying to do. And so it is a partnership that we're working across the area to try and do this, and it is about trying to reduce that spread of transmission. So I thought I'd just give you that as a little bit of a picture, just to kind of explain why, so that it feeds into some of these questions. You'll understand when I go back and talk about Test, Trace, Protect and the regional cell and all the rest of it. There's a whole structure underpinning the decisions we're making. It's not just being made in a vacuum.
That's brilliant. Thank you very much for that, Megan. Are you okay if I get started straight into the questions?
Go for it. Sorry.
Right, so our first one is, are student cases registered in the PHW Ceredigion figures, or are they in their home counties?
The answer to that is it depends on what address you put on the application for a test. So if the application for a test is made using your university address, then it gets counted in the Ceredigion figures. If you put your home address down when you applied for a test, it will be counted in their figures. So that's the reason why we've been working with the university to get the message to students to say, please use your university address, because we then know about you because you come into our queue. We are aware of you, and it's us that's contact tracing you. If you put your home address down, it will be somebody from your home address that will be doing that tracing. So yes, you are part of our figures if your address is a university address.
Brilliant. Our next question is, when should I get tested for COVID-19 and how do I get a test?
Mike, do you want to pick that one up?
Yeah, by all means. I think one of the things that I find a bit frustrating about all of this is that the government seems to have honed in on the magic COVID-3, you know, a persistent temperature or a persistent cough, and then this other loss of sense of smell. In truth, if you look at things like the Communicable Disease Surveillance Center in America and their list of COVID symptoms, it's massive because all the respiratory viruses can cause all of the symptoms to a greater or lesser extent. So the general advice is, if you've got one of those magic three, those certainly are a key marker that seems to be consistent around what is associated with the coronavirus. But in truth, we also know that children, for example, but many adults will have gastrointestinal symptoms. That's also common with the flu A virus. So any of these broad symptoms can be associated. So even the sniffles might be COVID in your case. So sometimes we try to encourage people to, and particularly if we know where there's an outbreak going on, we personally try and buck the system to get people being tested if they're part of an outbreak. So in an incident like you've had in the university with a few people being infected, those where you've had contacts and there are mild symptoms, we have been encouraging people to, and even trying to facilitate people through the system to actually get tested, quite honestly, because we know that's the only way to get on top of it. The contra view of all of that, of course, is if you haven't got any symptoms, there's little point in you being tested. Just because you might have been a contact, we wouldn't automatically start screening people who don't have symptoms. So the magic three, yes, but where there's an incident going on, then we are trying to facilitate testing of people who've got even the mildest of symptoms so that we know exactly what's going on.
That is brilliant. Thank you, Mike. And so how would they go about getting a test if they had a symptom?
Okay, there's a couple of means. One is what we call the portal, which is the UK government website for booking a test. So there are two testing sites in Aberystwyth. There is a drive-through site down in the town at the council headquarters. And then we have a walk-in site at Paddern, which is right next to the Brongleis Hospital. The walk-in site is there until Sunday. Next week, we have a couple of days without it as they put a permanent site in. But as of Thursday of next week, there will be a permanent walk-in site in the university on that Paddern nursery site. So there's two ways of doing it in Aberystwyth. So you go online and you can book a slot in those. You also, if you're unwell enough that you can't make either of those, you can contact your university welfare, and this university has a process where they will get the test and bring it to you at your house. They have a limited number that they can do that, so they would be encouraging you to go to the portal first, and I will find the address and send it to you because I don't have it right in front of me, but you can find it if you just search Book UK COVID test on any Google. It will take you to that. The Welsh Government has a link to it as well on the Welsh, on gov.wales, and you basically book yourself a slot, and then or alternatively you contact the university and they will organise getting a test to you.
That's brilliant. Thank you, Megan.
But again, we're looking at people with symptoms, and the reason being, if you test negative, If you don't have symptoms, we would expect you to test negative, but that doesn't mean you won't then get the virus in a couple of days. The fun thing with this virus is it can take up to 14 days to actually give you symptoms. And I can test you on day 3 and you're negative, and I can test you on day 7 and you're positive. So it is the nature of the virus that we would say the minute you start showing symptoms, book a test and go get a test.
Brilliant. Thank you. Our next question is quite a big one. So how can you justify the social restrictions?
You've missed one.
Oh, go on, Mike.
Well, you
Yeah,
asked why. Somebody asked why 6 specifically indoors. And I was going to jump in with that one because
Go ahead, Mike. Yeah.
This is a bit of a mystery to me as well. I think this is one that the experts on SAGE must have come up with. And interestingly, it's not 6 in Wales, but it is 6 in England, and it's a different 6 in the 2 countries. So it's all a bit, up in the air. Now, I personally think Wales is probably in a better place, but I was one of these people who had 6 children. So which 2 do I ask to leave my house when I go into this scenario? And of course, I think therefore the 6 was probably picked up on the basis that that's the largest normal sort of family, but there are abnormal families like mine that had 8 in it when they were living at home. Now, so in England, they talk about any 6 people from any family meeting together. So it's all a bit odd. In Wales, it's more than 6 if you've got children anyway, or children under 6. So it all comes down to everybody trying to manage the likelihood around the development of an outbreak. And we know right from the very beginning in China that that most of the multiplication of the virus happened within the family unit, however that was described. So I think that's probably why the 6 was arrived at. Now in Wales, it became even more complicated slightly when they went into these areas in lockdown, where they said it should only be now the family, or even if you had an extended family, which you could then sort of mix and match, as it were. So it all comes down to trying to find ways of socially distancing individuals, or on that sort of basis. So it's nothing magic about it. You may have seen the I can't remember which comedian it was, but he did a lovely piece around. So it's the 7th person who's going to get it type thing, and of course it's not. It's just trying to find a way of managing the social distancing and trying to get everybody to understand it. And in some respects, it makes it more complicated. But I'm sure Megan might have a view as well.
Yeah, I was going to say what we're seeing in patterns across Hywel is the transmission within households. So one person in a household, and we're seeing this within the university as well. So one person in a flat was part of COVID positive. We're now beginning to see a number of flatmates now testing positive as well. So the most transmission we're seeing is within households. And so the whole idea of the rule of 6, which was slightly different in Wales, as Mike said, was really about trying to reduce those networks that you have to reduce the risk of transmission. You're never going to completely remove your transmission. You're never going to completely be able to distance from everybody in your entire life. It's not possible unless you become a hermit and live in a cave. But what you are trying to do is reduce the number of people you can potentially infect or you can potentially catch it from. So the less people you have in that very close proximity, the better. And we know within households, it's really difficult to avoid sharing bathrooms and kitchens, and you eat together and you sit together to watch TV and all the rest of it. Those are the ones that you are not likely to remove. So by trying to reduce those households mixing, by trying to reduce mixing with wider groups, then that's what we're trying to do, is again, going back to that distancing with your lovely contraption that you went walking in, Nate, is very much about trying to understand that those distances between your group and your family and that group and that family is how you're going to actually break that transmission down.
Brilliant. Thank you for that. Just a note that Trish has put in the chat saying that also at the university asks you to record any symptoms on your student record. So that's something that all students should be doing. Right, this one's it's a heavy worded and it's a long one. I apologize. So how can you justify the social restrictions, i.e. banning in-person society socials? Is this not more likely to have a negative impact on the health of students? I worry that restrictions within pubs, on top of banning society socials, will leave a lot of young people away from their homes and families and without a way to make friends. Can we be honest about the sacrifice young people are making? Many have not settled into their lives yet and have lost the ability to do that. The university has provided no real hope or real support that adequately faces the fact that there will be suicidal students as a result of this. It has been presented under the guise of trying to keep us safe, but it's not us who are at risk. Have you measured up the life-shortening effects of loneliness and isolation with the risks contracting COVID? The health of students, especially freshers, will slowly decline the longer you keep this up. People need human connection. I understand it's quite a harp on there, but...
Yep. Let me start by saying we do understand the balance and we do understand the risks. I also want to say that one of the underpinning that started the spike was a face-to-face social where there wasn't distancing in place. And because of that, we had 12 to 13 cases from one face-to-face social. So I think the issue we're aware of is, and particularly around alcohol, I'll be very honest, the more people consume alcohol, the less you are able to and maintain social distancing and hand hygiene and all the other things that we know reduce the risk of transmission. I think the concern we've got is that it's about that balance, and we do understand the sacrifice. I can't talk about the university, and I'll be honest and say that I can't talk about that part that was mentioned. We understand the loneliness risk. We understand the well-being risk. We do understand the pressure it puts on individuals. We are, as a race, very sociable and want to be. We're not lone wolves, though there are the few exceptions. But I think there is also a balance of what this disease can do. And I think there's a lot of this thing about, well, everybody recovers from it, it's just the flu. It's not. There is a lot of evidence now around the long-term damage that this can do, even in young, healthy individuals. There's a lot of damage around some of the impact it has on your lung capacity. There's also evidence around heart, around other organs, that this particular virus can be quite nasty to. On top of which, if you are not isolating, if we're not trying to reduce these risks, it's where you take it to next. So if you go without this and you pass it on to someone who has an underlying condition, who has diabetes, who has COPD, who has a whole range of different conditions that you may not be aware of, that's when it becomes deadly. And that's when we start seeing the rise of people in hospitals, the rise of people on incubators, and we see the death figures rising. And I think we have to take a balanced approach that actually we need to stop people getting sick, and we need to try and stop people getting damaged permanently. And we need to stop this spreading into communities, and particularly to individuals that are much more vulnerable, that you don't know their vulnerabilities. And again, that element about, you know, you're settling in somewhere new, you don't know each other. Well, you don't know that the person in the flat across from you, or going into the pub across from you, has type 1 diabetes that puts them at much greater risk, or has any other of those conditions that can put them at much greater risk. And so I think there's a balance between, you can still be sociable and distanced, and you can still find ways, and it's a brave new world that we're trying to find ways of interacting. But I think we do need to have a conversation about how we find that balance. And Mike doesn't always agree with me, and we're okay to disagree with it. But I think the issue we're trying to do is we need to find a balance and a way of doing it that reduces that risk to those that this disease is very, very dangerous to, while also finding a way that people can be sociable and can have those connections and maintain those connections in a way that goes forward.
Brilliant. Thank you very much for that, Megan.
So I have a slightly different view to Megan, as I've said in the sidebar, but I am absolutely clear that no one individual knows what their individual risk of this virus will be for them. So I'm an obese 67-year-old git who's been around for a long time, and I know that if I get this virus, I am at a higher risk of it killing me. And I've said that openly. But frankly, from my point of view, that does not, bother me personally. Now that's because I'm at where I'm at, and I've lived 67 years, and some of you are less than 20 and have therefore perhaps only lived 18, 19 years. So, you know, but any one individual could die of this virus. But I have to say also, and that's one of the things I picked up on right at the very beginning in April in a blog post, was that at the start of this pandemic, we knew that 80% of individuals who meet this virus will only get a mild illness. And when the Chinese were first talking about that, they were saying there's no such thing as asymptomatic infection with this virus. But we now know from the UK publications that 75% of people don't get an asymptomatic infection. So this virus, like all coronaviruses, is normally a virus that will cause the equivalent of a common cold. But equally, like all respiratory viruses, they can all cause this vast gamut. And I was teasing Megan earlier about the rhinovirus up her nose, and the other virus that we're seeing circulating among children, and some of those in nursing homes who we're doing much broader studies in, is that the rhinovirus is around. And the rhinovirus, which gets its name because it only normally causes a head cold in the nose, rhino nose, will put people on ITUs and will occasionally kill them. And my first blog post was this idea of a question of scale. On the global scale of things, most people aren't going to even meet this virus. Most people are not going to get an illness with this virus, and most people will not die of this virus. But an awful lot, it's over 1 million now, have died of this virus, and that includes babies, children who didn't have any risk factors for this virus. And that includes you, equally, who don't have any risk factors for this. So it's just the fact that there's just so much of it, and we're all prone to it because we've not met it before, that we see these large numbers. And we have a responsibility to our friends and neighbors to try and maintain that social distancing while we're going through this, because you never know when that individual's number might be up, and you don't want to be the person that passes it to somebody else, quite frankly.
That's brilliant. Thank you very much for that, Mike. So our next question is, why is in-person teaching deemed safer than social gatherings?
The issue we've got, and again, I'm going to come back, I can't go into the full university element, but the issue we've got is around the distancing. So we've got the in-teacher teaching that the risk assessments show if they're in the front of the class, you're all 2 meters away, they've got the distancing set up, that the risk factors are reduced. Again, going back to the socializing, you're going to be in larger groups, you're going to be probably not maintaining your distance. There's going to be greater risk of that transmission happening because of that. But I do know that there's been risk assessments done on the teaching, and the one-way system you've now introduced, and the face coverings, and all of the elements that have been put in to reduce those risks as low as possible. And that's the reason why that's been given the green light. Socializing is where you don't maintain those distances, you don't maintain those smaller groupings, you don't maintain any of that, and that's where the risks increase. And I think that's the conversation that we've been having in the IMT. And actually, the incident management team meeting had a long conversation, and for a while you weren't face-to-face teaching, and that was all paused while we went through what is the figure showing us and where are the information coming from. And at the moment, the transmission we're seeing within the university students from the data we have is within those social areas, not within the educational teaching areas. And that's the reason why one was green lighted and one is currently on hold but is being reviewed.
Okay, brilliant. Okay, so I know that there is conversations taking place about if societies and sports clubs can go ahead with their core activities. So someone has said, I'm struggling with my mental health as I'm not able to train for my sport. Why can't some training go ahead in a COVID secure way where it is monitored to ensure guidance is upheld?
That's the conversation we're having tomorrow. So we've agreed at the incident management team today that we would have a conversation about going through the list very rapidly about what can be restarted and what can't. And that's going to be very much around that COVID security. The issue is also around is how we make them COVID safe. And so there's a number of issues about, we have a gym in another area that the actual main gym is fine, but they were running classes and then they had a COVID outbreak in a class. So it is about finding that balance. Again, it's that balancing act we have to go through, and we do this regularly in public health, which is why we're calling it, we're deemed to be both an art and a science in public health, because there's a constant balance that we have to come up with between keeping an eye on and protecting that population health and those individual and some of those issues that need to be resolved. So yes, we are aware of it, and we are hoping to be able by Monday to start some of those elements that are COVID secure, that have lower risk, to begin. So we're having a discussion tomorrow. So hopefully Monday there'll be some announcements.
Brilliant. That's very good to hear. I know lots of people will be happy to get some news on Monday about that. So the next question we've got is, why can my friends at universities in areas with much higher infection rates take part in uni sports teams, but not us in Aberystwyth?
The answer is it all comes down to each individual area. Ceredigion has a very low prevalence overall, and has historically throughout this had a very low prevalence. And I think one of the ways that they've managed that is by dealing with and trying to close down potential sources of infection as quickly as possible. So I think Aberystwyth, the decision was taken, we had a very huge spike. So just so you understand, the university was running at about 8 cases per 100,000 population. And then all of a sudden we went up to 41 because of the transmission within the university. So that block of what was going on in the university drove the figures up to almost 5 times what they were over the summer. So there's an issue about understanding that and trying to make sure that we didn't hit the trigger that put the whole of Ceredigion, or potentially the whole of Aberystwyth, into even greater restrictions, and to bring that figure down. We're now down to 22 cases per 100,000 because of the work that all of the students have done. And they've been brilliant, and they've responded really, really well. And the work that's been going on to try and reduce that rate of transmission has been successful. And that's why we're now able to start looking at how we reintroduce some of these societies and some of these events, because we're now bringing down that infection rate, and we're now bringing down those cases, and we're not seeing those big spikes in numbers that we had back at the end of September and beginning of October. And so the hard work and the sacrifice, as the word was used, that was made by students has really paid dividends. And it means we're now able to start doing that work of releasing and going back into reintroducing some of those clubs and societies. And then hopefully, if it continues, maybe we'll be able to also start bringing in some of those social elements as well. But again, it is about understanding those risks and understanding what we're trying to do is stop it spreading in a way that we can't control, and in a way that makes it safe is not the right word, but we can never make everything completely safe, but we can reduce those risks of people getting it. And that's what we've done. And the work of the students has got to be commended, because the ability to do and to isolate and to put up with doing that, and to have your first years at university, I remember mine very fondly, but having those disrupted in the way you have, both in terms of your A-levels and trying to start in this COVID world, I think you've just done magnificently in trying to take your part, to play your part in reducing that COVID risk, has really helped bring our numbers down and saved that going into even worse restrictions, because you've played your part. So I want to kind of say thank you to the students that are here, and the ones that maybe listen to this later. You have actually played your part very, very well, and it's helped reduce that risk. We've almost halved our incident rate in a week because of the work you guys have been doing in maintaining those distances.
That's brilliant news. I think it's great you're thanking the students like that so bluntly. Like I know they'll be very happy with that. I feel sorry for the freshers even more, the ones who have missed out on their 18th birthday parties and their holidays with their friends over the summer, and they've done a lot of hard work by doing this. So
yeah, and they did, and I had to postpone my 50th birthday party. I couldn't have my family round because of the same reason. So and I'm about to move home, and I won't be able to have a housewarming party. So I'm very well aware of the sacrifices, and I mean, as Mike was saying, I'm in a similar position. I have 1 kidney, and I am 50, so I am already in a risk factors as well. So I'm aware of my risk and very clear and concise on it. And I have a 17-year-old in the house. So again, I'm very well aware of the sort of things that he's had to not be able to do because of what's going on. So I do think it's not that we don't understand, and we do want to thank you for helping us reduce those risks and actually bring our numbers down, because it does make a big difference.
Brilliant. Thank you, Megan. So following on from that, these decisions that you're talking about in Aberystwyth and campus, how are they made and who's involved in those decision making?
So the university's done a lot of the work around before you all arrived, and did a lot of work around, oh, I love that cat. Sorry, I get very easily distracted by cats. I have 4 of them, so they distract me very easily. So a lot of the plans and policies were put in place before you all arrived on campus. So the university worked with ourselves, worked with the local authority, worked with Welsh Government to put in place and to do those risk assessments. So that was all in place. And actually, because of that, and because of all that work, we've been able to enact the plans a lot easier. So once we hit the Welsh Government trigger, which was 25 cases per 100,000, which is a lot lower than in England, just so you're aware, we bring in what's called an incident management team. So that brings together the local authority, the health board, the university, ourselves in Public Health Wales. Mike and I are both on members of that group, the student union, and we all basically look at what's it telling us. So what's the story? What's the data telling us, both from the hard numbers of the number of cases, the age groups that's being shown in, and then actually the information that's coming from contact tracers. You know, where are they the students? Are they wider community? Where are we seeing a common pattern of where people might have picked up the infection? And then we just make all these, we then discuss based on all of that, what we're going to do as a team, as a partnership, to actually bring those into being, to try and reduce those numbers. And so a number of decisions are taken. Pausing face-to-face teaching was made by the university and brought to the table, and we agreed that we would pause that until we reviewed the numbers. We were then looking at all that information, and the student, you know, we were then isolating students because that's following the protocol and the science. And so there's a lot of that's been going on. So those we're meeting daily for the first week, and we meet about 3 times a week. We all come together and meet, and we just had one this afternoon, which is when the agreement was that we'd have a small group review and make recommendations to Monday's meeting on what to release and what not to release. So it's a real partnership effort. The students' union is represented, the university is represented, and then we're bringing that expert advice. So it is not being made without understanding the science, understanding what's happening and what the picture's telling us locally.
Okay, brilliant. Thank you very much. People will be interested to know who's involved with that.
Yep, it's Trish represents the students, but we also, I think you get invited to them as well, Nate.
I do, yeah. I've been to a couple.
Yeah. So we're trying, and we're you know, hopefully from this we'll get some feedback that we can take back in as well, because we do want to make sure that we do have students represented at the table, being involved in understanding what the decisions we're making and why we're making them, and feeding that back, because I think that's important, that you understand we're not doing this in a way that's saying you're not going to do this. You know, we're not sitting there locking you in a room or anything. It is about trying to do what's best for the whole population, not just the university, but also the wider community across Ceredigion. And as I said, we do have other pockets that we are also looking at. Our focus isn't just on the university. We are aware of every case that is going on across the whole of Ceredigion that is playing into those numbers.
Brilliant. I've got another sport-based question now. So why have sports and leisure centres in Ceredigion been closed? What evidence is there that these activities are high risk, as I've not seen one case in the UK linked to exercise? What effect are these closures having on mental health and obesity levels? It was World Mental Health Day on Saturday, and there was so much publicity on how sports and exercise are so important for mental health, especially during the pandemic. Closing local clubs is also encouraging travel outside of the area, which could in turn raise transmission rates.
Okay, so the sports and leisure clubs within the council's remit are a decision made by the council. So some of that is informed by evidence, and some of it's informed by others. One of their leisure centres was actually closed to become a field hospital. Just so again, we put that back into perspective of what was happening back in April and May when some of these decisions were made. There's also elements around how we reduce those mixing. And so I think it's also about trying to say there are other ways of exercising. You don't have to go to a gym, but we do have evidence of transmission within gyms. So it is around some of the local stuff we've got, is we're aware of gyms where we've closed the gym, had to clean, and they've had to go in and put in new compliances in place because certain rules weren't being followed. As I said earlier, we had an issue about a spin class and about a circuits class where we had about 5 cases all linked to one class. So there is evidence. It's possibly not in the published evidence yet, because how you can publish some of this is very difficult, because a lot of it is more anecdotal, and it's more difficult to prove than some of the scientific journals would have. But we do have evidence of linkages within some of these sports facilities. So again, it's about those risk factors. It's about closed areas, not the best ventilation. It's about the hygiene of the equipment in between usage. So I think the issue is that the council has taken a very precautious approach. And I think we're then having the conversations again through the IMT about whether that's to continue. I think what we've tried to do is say, we've tried to open them up, and there has been gyms that have been able to open because they've gone through those processes. They've put the COVID secure in place. They've removed equipment. They've blocked off equipment. So again, they're keeping their distances. The issue with sport is, again, it comes down to the sport and the procedures that are put in place around it. So I know Football Association Wales has put in quite strict regulations around the testing and around the procedures. I know the Rugby Union, the Welsh Rugby Union, is doing the same, because I've actually had conversations with the Welsh Rugby Union locally around restarting training, and about the training can restart, but it has to be managed in a way where people are maintaining their distancing. They're not changing in the changing rooms together. Because the problem with a lot of facilities is you can get out on the field and do your training all distances, and then you all go back into the changing room and you're all on top of each other in the changing room. So there's issues about where the crunch points are and how you can work them so that things can be started again. But again, you can go out for a walk. You've got some beautiful countryside within easy access that you can go for a walk. If you can get access to a bike, you can go for a bike ride. And these are things that you can do in groups and be distanced, and do it in a way that means you can stay with groups. And if you've got friends that you are in a flat with, i.e. your housemates, you are a household. And so you can go out together for a walk and go out together and do things. And I know it's not ideal, and I know you might not get on with the people you're in a flat with, but there are ways that you can manage it and you can still exercise. But we are looking at that in terms of the university facilities. As I said, we're going through that tomorrow, and hopefully you'll have a decision on Monday. But I think the issue is more where the clinch points are, is particularly around swimming pools. It's around actually being in the enclosed space, because the ventilation isn't always as good as it could be. It's the changing rooms where you're all on top of each other. So there's a whole series of those reasons. Might not be the gym itself or the training itself. It's about that lack of social distancing and lack of availability of social distancing in some of those places.
Brilliant.
Does that answer the question? Because I always feel like I'm getting very lectury, and I'm trying not to be.
No, that was brilliant. I think reminding people that we have got gorgeous countryside around here. They can go on a walk, they can go on a bike ride, and hopefully Monday we'll have some good news as well. We'll be able to share with them.
That's what we hope.
Yeah, brilliant. Okay, our next question. Wasn't it always a risk for students to come back?
I think it inevitably it was a recognised risk, but I think, like everything, what we're trying to do is to return to some sense of normality, or to allow. I mean, obviously the economy is one side of this, but also those educational opportunities are key to people's personal development. So these are risks that were worth exploring and seeing how we managed. Nobody wanted to see universities and schools close from the point of view of education, in the same way as everybody would like to see the economy getting back up and running. So I'd always recognized that inevitably anybody coming into this, into Ceredigion, be it yourselves as students or holidaymakers, the economy of Ceredigion is very dependent upon our holiday trade as well. So welcoming holidaymakers in from across the world or England or the rest of the UK is something that we anticipated and would recognize that potentially we would then see incidents. And the trick was to always be on top of those incidents as quickly as we could. And certainly that was the experience from the Aberystwyth point of view, as Megan was saying earlier. It was remarkable how quickly the incident management team came together to handle this particular incident. And as a result of that, as she's been just commending you earlier, you actually were able to dampen it down very, very fast. And that's what we've got. I mean, you can't keep going into lockdown. And I know there's this great debate, again, doing the rounds as to whether you should have one of these circuit breakers or whatever. You don't want to keep doing that. You want to try and move the population into a position where they understand how, where the risks are. Those scenes in Liverpool that were all reported at the weekend were just daft. If you behave like that, then the government is going to put us into lockdown, because that's the sledgehammer that they've got available to them to make it happen. But that's not the best way forward. The best way forward is to start opening things up gently. Opening up the university gently was one of them, and then when we do have it, if and when we get an incident, to jump on it fast.
I think I'd echo that, and I think we knew there was a risk, which is why all the planning was done over the summer and all the conversations were held with the university, with ourselves, with the council, to work out how we manage all of this and how we do this in a way that is going to allow you the best possible experience in the current climate. And I think it is about those behavior issues that we are having concerns about, and it's why areas are going into restrictions, is because there have been issues with that. And I have to say, we had 12 cases in one weekend, which is a huge amount for Ceredigion. We've now managed to go to the point where we're seeing that reduction. And so we've got about 35 students in total have tested positive for coronavirus as of today. And when you look at some of the other universities where they've got 450, I think one of the universities in the north of England had 700 students. So I think the work we've done and how quickly we've come in and dealt with this has meant we are reducing the need for further restrictions, for not even getting in-face teaching, so that you're actually coming to Aberystwyth and sitting in an isolation while you're going online learning. So I think we're trying to do it in a way that is managing the best that we can. And as I said, hopefully on Monday, we'll be able to release even more because of the hard work that the students and everybody else, I'm going to take some credit because I'm part of the IMT, but we've all worked really hard, helped us to actually bring those cases down. So I think that's really important. And again, that's what's made the impact, and it's allowed us to get on top of this really quickly and really rapidly.
Yeah, I was about to say, yes, we can say well done to students and thank you for all your hard work, but also thank you to you. Like, the IMT has done a lot of hard work, and 35 cases is nothing in the scheme of things, is it really, compared to other places? So no. I think a lot of hard work has been done. So well done, and thank you to yourselves as well, really. Okay, our next question that has been submitted. Do I need to isolate if I've been in contact with someone else who's been told to isolate?
No. So what'll happen is you will get a phone. So the person who's an index case, so Nate, you test positive for coronavirus.
Yeah.
You will get called by a contact tracer who will then work out when you first got your symptoms, when your test was done, where you were and who you were in contact with. We will gather all of those names. We will then contact every single one of those names and say, you've been in contact with a positive coronavirus case. We would now like you to isolate. Your the last time we know you were in contact with them was on today. So we're looking for you to wait till the 29th of October. We'll ask you to isolate. If you're in a house with somebody who's been asked to isolate because they're a contact, nobody else in the household has to isolate until you develop symptoms. So if I've been in contact with you and I'm asked to isolate, then I isolate, but the rest of my household doesn't. But if I develop symptoms and go and get tested, then the minute I develop symptoms, everybody in my household needs to isolate until the test result comes back. If it's negative, then they can carry on and I just finish my 14 days. Because I might have, as Mike keeps pointing out, I might have rhinovirus. I might get a cold. But if I've been tested negative, I've finished my 14 days, because I could still test positive in 2 days' time. but the rest of my household can go back on. At the end of the 14 days, if I don't get sick, then I'm free to leave my isolation. So if you're a contact of a contact, it's the nicest way of describing it, you don't have to isolate unless the person who's been identified by the contact tracing team becomes symptomatic.
Okay, brilliant. So if
it's a bit complicated with all the contacts of the contact of the contact, but yeah.
Okay, so if I tested positive, then I'd been in contact with you and you'd been asked to isolate, but
Correct.
you'd been in contact with Mike. Mike wouldn't need to isolate.
Correct. Unless I develop symptoms, in which case I would then be contact traced in the same way you were, and my contacts would be isolated. The whole plan is that what happens is you get a narrower and narrower group of people that you are then breaking that risk of infection. So if I continue to go out and about, and I continue to go meet Mike, and I continue to go and, you know, catch up with other people, then I'm increasing the risk of spreading that disease. So that's why I'm asked to isolate. But if I get symptomatic, then Mike would be asked to isolate, because he then is a contact, you know, he then is at risk of spreading that to someone else. So what we're trying to do is narrow those risks. And I'm going to be honest and say, when we first contacted students, we had 54 contacts from 12 people. We're now contacting students and we're getting 3 or 4, which is, generally speaking, almost all their flatmates. And that is what's making the difference, and that's what's breaking the transmission, which is why we're now able to have the conversations about restarting other things. Because that's how you narrow and how you break those transmission chains, is by reducing the number of people you get close to that you can pass this nasty, horrible, mean, vicious little bug onto.
That's brilliant. That it's great to see that the contacts have been going down as well. That's really good to hear.
Yeah, so students have been isolating as they've been asked, and that's just what's actually driven it. That's why I was saying thank you, because that's what's driving the reduction in cases, is the fact that they've been isolating as they've been asked and cutting down their contacts when they've been asked to.
That's brilliant. Okay, so I've noticed we've only got a few minutes left, so I'm going to go to our final question now. I just want to say thank you again to you both. So our very final question is, am I allowed to be going to travel to see my family? If I get COVID, can I isolate at home with my parents?
There's a bit of a dichotomy with this, and before Mike comes in and says yes, there's a bit of a dichotomy. What I would say is, preferably, I would prefer you didn't, because it means you're then taking that infection to your household. However, personally, I understand the need to go home and be looked after and to be with people you love. So I'm going to give you the 2 answers. So preferably, if you're identified as a contact, it's better that you don't go home. And it's better if you don't go home if you are a case and you are symptomatic. However, I understand that as human beings, we want to go home. We want to be with those that are going to look after us and be in that feeling of being at home with the family. I know that. I did that when I was a first-year university and was in a car accident. So the first thing I wanted to do was go home. So I understand that. I think the issue that needs to be understood is the risk that if you go home and you've got COVID, your whole family needs to isolate with you. If you're COVID positive, they need to isolate from the minute they pick you up for 14 days. And you need to make sure that you're telling people that your household is involved, so that we can add you to our contacts and make sure that you are all okay, that your family's okay, and we can keep an eye on them. Because I do understand that that's what people want to do. But I would sit here, I would be wrong in saying, travel home, travel home, travel home. But my answer is I understand that people do that. And we have cases in Ceredigion of people who have contracted the virus in other parts and have come home to Ceredigion. So I think the answer is in theory, no. But in practice, if you do, your whole household that you go home to need to isolate, and you need to let us know so that we can have them added, and they will then continue to isolate. We can make sure that that whole household is isolating. But I'll let Mike come in as well, because I know Mike had a view on this too.
It's not dissimilar. I threw this one into today's incident management team, because I said, quite honestly, if I was a parent and my son or daughter, well, I am a parent, but if I had a son or daughter currently at university, and they said that they'd been told they have to self-isolate because they've got either they're a contact or they were positive for the coronavirus, I would have a conversation with them with the aim of rescuing them and bringing them home. But that's in the knowledge that as I've already identified myself as a 67-year-old obese individual. I've got 2 risk factors. I'm married to a wife who's also 67, is an asthmatic, and I have a grandson living in our extended household on our property who has only 1 kidney. So there is multiple people who need to be involved in that conversation. So I would go and negotiate with all of those individuals, say, well, what do you think, folks? These are the risks. I'd go through the same sort of argument that I was explaining why I was in a different position to Megan in some respects around the virus. It could kill any one of these individuals, and equally those who don't have any risk factors in the household. But the risk is X, Y, or Z. And we've had these sorts of conversations in our family. And then if I did choose to go and pick up my son or daughter from the university who had COVID symptoms, I would manage that. I would do that. I would take a risk managed approach. I would go and pick them up in my car. If it was a long journey of, where we had to stop for wee breaks, etc., I'd have to manage all of that, making sure that they were wearing an appropriate face mask or face covering, etc. I would, if they didn't need a wee, then I would choose to, if they needed some food, I would choose not to allow them to go into the restaurants and pick up the food themselves. I would do that, etc. So I'd take that sort of responsible approach to this, because one of the things we did discuss, and we've been discussing here this evening, there are mental health issues associated with isolation and with individuals' different circumstances that we've got to be aware of. And, we are all human and we all have needs, and those have to be balanced. But if you are going to take a risk-based decision with your families, which is against the law, so, all of us would be liable to prosecution under that law. However, there is a get out of jail free card.
What you want?
Which is the mental health one. That's clever. Which is the mental health one. So, that is a reasonable excuse under law. So there is that get out of jail, but you've got to take it in that socially responsible and risk managed way. Do not take these decisions lightly, because as Megan has been saying, as I was saying earlier, you do not know which individual might unfortunately die as a result of getting this virus.
Brilliant. Thank you very much for that, Mike. Right, I think our time is up. Thank you both so much for this. I know a lot of students have really appreciated it. I think we'll definitely do something again like this in the future.
Yep. I was just going to offer and say, if you want us to come back and do another session, I think Mike and I would be very happy to do so. I'm on holiday next week. I'm packing boxes for my move, but we are around, and there will be people who can come and do these again if you find them useful.
Brilliant. I know a lot of students have really appreciated it, so thank you both so much.
These conversations are extremely important.
Yeah,
definitely. Brilliant.
And if you want to do some grouping around certain things, like about the evidence on isolation and on distancing and things, we can actually bring you and have some conversations around what the evidence is and why that sort of underpins some of the guidance. I'm happy to have some of those as well. If you want to kind of theme it around certain issues, we're happy to do that as well. This was the first, so I think Trish was trying to make it quite open for people to have those conversations. But I think we're happy if you want to group them around certain subjects, and we can come and we can make sure we've got the right experts for you as well.
I also try and answer similar questions on the blog if you want to go that direction as well. But they are published as long as they are not specific. It's not an absolutely open blog. It's one because I am primarily a doctor. At the end of the day, I always moderate all the questions, and there's at least still 2 comments that are sitting there waiting for an answer from the individuals who made some rather stupid questions, I think. So, but it is otherwise open.
Okay, brilliant. Okay, thank you again for your time. Hopefully we'll do this soon. Megan, enjoy your week off.